Hi everyone, welcome back to my channel. Today we're gonna talk about critical care concept question. Come, let's talk about this. This is very important in Nclex. Remember, Nclex, they're gonna test your knowledge based on this. As you are joining me, indicate in the comment section, I am here. Thank you so much for joining me in my live stream. Let's go through this question. The charge nurse is evaluating the skills of a new registered nurse assigned to care for a client with shock. Which action taken by the new RN indicate need for further education? Just take a look at this question. We're gonna find out the keywords of this particular question. We are talking about critical care. Take a look of this question, then find out the modifiable phrase, the keywords of this question. The keywords of this question is which action taken by the new RN indicate the need for further education. I always say this, in any question, pay attention to modifiable phrase. Pay attention to the last sentence of that question. We are talking about critical care. Guys, I hope I'm communicating. You have to grab something this morning or this afternoon or this night. Make sure you go home with something. I just want to teach you guys how to answer questions. Paying attention in modifiable phrase of every question is very important. Not just answering question just because you want to answer the question. No. You have to think critically before you can be able to select the correct option. Let's go to the option. Number 1 says, administer furosemide Lexis to a client with pulmonary artery wedge pressure of 24 mm mercury with a client that is having cardiogenic shock. Let's talk about that number 1. You have to think about this medication, Lexis, furosemide. What is this medication all about? This is the question you will ask yourself. What is this medication all about? This is a diuretic, water pills. This medication is used for congestive heart failure, pulmonary edema. When a client has a congestion, they give this medication. Another keyword that you need to know concerning this option number 1 is what is pulmonary artery wedge pressure. If you don't know the meaning of pulmonary artery wedge pressure, I think you will miss the whole thing, because you need to know that so that you will not make a mistake in picking up your correct answer. Pulmonary artery wedge pressure is just a measurement stuff used to indicate a left ventricle problem. If there is a problem in the ventricle, it is just like a balloon inserting inside you to visualize your ventricles. But this pulmonary artery wedge pressure has a measurement, has the normal range. Remember, in this client, it is 24 mm mercury. The normal range is 6 to 12 mm mercury, and the Nclex They will test your knowledge based on that. I want to touch everything in this option. We have to touch everything. We don't want to remain one place. We want to use this particular question to treat so many things that you need to know before your exam. In this pulmonary artery wage pressure, the normal range is 6 to 12. When it is low, it is less than 6. It indicates that this patient has hypovolemia. Hypovolemia, fluid deficiency. When it is above 12, it indicates fluid overload. I hope I am communicating. Anytime you come across this test of a thing that causes pulmonary artery wage pressure, you have already known. You know the measurement. It measures from the normal range is 6 to 12. Anything below 6, that client has fluid deficiency. Anything above 12, it has fluid overload. I hope I am communicating. So, using the power of elimination, we're gonna eliminate this number 1, because I administer furosemide to this client that is going through this pulmonary artery wage pressure. It is acceptable. It is normal thing to do. It is normal thing to do. Remember, the question says, what action taken by the new RN indicates that the RN needs further education, needs further teaching. What will that new RN will do that will make you, as a charge nurse, know that new RN needs education? That is the scenario of the question. So number 1 is eliminated. We're going to eliminate number 1 because everything in that number 1 option is needed for the patient that has cardiogenic shock, because this client has a fluid overload. The client needs furosemide, Lexis. I hope I am communicating. Let's go to option number 2. Option number 2 says, increases non-epinephrine infusion rate to maintain the MAP of greater than 65 mm mercury in a client with anaphylactic shock. What is non-epinephrine? That is the question that you're going to ask yourself. You have to go through all this process before you can be able to select the correct option. Don't just answer a question and select an option without having a rationale behind every option. Hello everyone. I hope I'm still communicating. Number 2 says, increase the non-epinephrine drip, non-epinephrine infusion for a client that they want to maintain the MAP of greater than 65 in a client that has anaphylactic shock. This client has low blood pressure. You know the signs and symptoms of anaphylactic shock? Low blood pressure, hypotension. So, non-epinephrine, another name, the brand name is Levofed. It is a drip vasopressor used to increase the blood pressure It is used for hypotension. Hello? So, this option number 2, it is expected. That is the correct option. It is expected. It is the correct intervention to give to a client who has anaphylactic shock. It is okay. Number 1 eliminated. Number 2 eliminated because it is okay. It is expected. It is the normal treatment for these patients. I hope I'm still communicating. Do not misread this question. Let's go to number 3. Number 3 option says move pulse oximeter sensor from the finger to the forehead of the client with septic shock. There are so many areas that you can put pulse oximeter sensor. Either you place it in your forehead, you place it in your finger, or you place it in the earlobe, you place it in the palm for the newborn babies, or you place it in the foot. So for this new RN, to move the pulse oximeter sensor from the finger to the forehead of a client with septic shock is expected. That is the correct intervention. I hope I'm communicating. That is the correct intervention for this client. So for the new RN, doing option number 3, it is okay. It shows that new RN has the knowledge of critical care concepts. Let's go to option number 4. A client who has hypovolemic shock. What is number 1 indication for hypovolemic shock is hypotension, low blood pressure, hypotension. So for the new nurse, to position this client with the head up, high forward position, sitting up position. Hey, you as a charge nurse or you as a supervisor, what are you thinking? What is your next action? This is what this question is talking about. For the new RN, to position a client who has hypovolemic shock in a high forward position, in a sitting position, pumping the head up, what is gonna happen? The blood pressure will keep on going low. The blood pressure will keep on going down. The blood pressure will keep on going down. And this client will have a severe shock. The client will have a shock and go into cardiac arrest. Any client or any person that has hypotension, you have to position the client in a transdermal position. Put the head down. Put the head of the bed down. Do not put the head of the bed up, because by doing that, you are causing more damage to that client. You are causing more damage to that person. I hope I am communicating. Drop the correct option in the comment section, guys. And do not forget to share this information. Do not forget to share this information. As you are sharing this information, you are helping me to create awareness. So we have eliminated option number 1, which is expected. That is a good intervention. Option number 2, expected. It is a good intervention. Option number 3, expected. It is a good intervention, but option number 4 is not expected. You're gonna kill this patient fast if you apply this option number 4. So the correct answer is number 4. I will post the rationale later. Try to come back to this video and go through the rationale because it has a step-by-step rationale. Bye. Don't forget to share this information. Please like this post and comment and share it out. I love you all.